Thank you very much. It gives me a great pleasure to be here today to present to you about the Sudan Medical Specialization Board and its project for involving the Sudanese diaspora. Let me first provide my gratitude to conference organizers and Professor Alam for allowing us to present and giving me this opportunity to be here. In fact, the Sudanese diaspora is huge in terms of number, in terms of talent, and in terms of expertise. That's why we started a program in the Sudan Medical Specialization Board under the title of Diaspora Engagement Program. And I'm going to present on this. The Sudan Medical Specialization Board, for those who came to Khartoum, this is the building. It is the building of Khartoum Civil Hospital that was built in 1909, and it now became the host of the Sudan Medical Specialization Board. The current leadership of the Medical Specialization Board, we have two surgeons, Dr. Al-Tayyib and Dr. Abdel Majid, President and Vice President, and myself in the cabinet for the Sudan Medical Specialization Board. In my presentation, I will brief you a bit about the Sudan Medical Specialization Board, and this is very important because it is usually mixed with the Sudan Medical Council and other, agencies. Then briefly, I will discuss the country landscape in terms of health worker migration. Then we'll touch on the purpose of the program. The Diaspora Engagement Program and our proposed approach, and then the implementation of the program and its implications, value, and impact. So, in brief, this is the Sudan Medical Specialization Board. It's a prime postgraduate medical education body in Sudan. And in fact, it colonizes postgraduate medical specialization in the country. So it's the main body that provides specialty training to medical doctors and health professionals in the country. It was established in 1995, and obviously before that, Sudan has been rich in terms of medical specialization, dating back to 1930s, and then subsequently following independence, the postgraduate medical body was set up in Khartoum University at that time, and then with other universities, University of Jazeera, University of Juba, and from there, it eventually evolved into the creation of the Sudan Medical Specialization Board to lead on and deliver postgraduate medical specialty training. The board graduated since its establishment over 3,000 medical specialists in different areas. And actually, that number is huge when compared with what has been produced in the past in the country. However, we produce not only for Sudan, and a good deal of this number practices outside the country currently. The board currently enrolls over 4,000 resident doctors in different specialty programs. We have currently 33 medical specialty programs in the Sudan Medical Specialization Board, including the 4 major disciplines: medicine, surgery, obstetrics, pediatrics, and a number of other medical specialties. We have a network of over 1,200 trainers, senior specialists in Khartoum and across the states who collaborate with the board in training of residents. The Sudan Medical Specialization Board is currently witnessing a reform movement, and this is actually marked with the last governing body meeting, which we call Al-Hay'a Al-Ulya, which occurred in February 2015. And very important decisions were taken at that meeting. I'll just review some of the major decisions. The direction for the Sudan Medical Specialization Board was stipulated in that meeting to move from medical to wider health professions. The board, since its establishment, has been mainly training medical doctors. Now we are entering into the area of training other health professions for medical specialties, and I will come later to this. The second major step was moving from provision of training to regulation and accreditation of training. The board has been mainly delivering training itself. Now the new policy stipulates that the board should more be focusing on regulation and accreditation of training centers. And a number of training centers were created, as will be explained later. Moving from single to multiple degrees, the board also has been offering its medical doctorate, which is a clinical MD in different specialties, as the main and maybe the sole degree until recently. But considering the needs of health services in Sudan and in some neighboring countries who are approaching Sudan, we are now moving to multiple degrees in terms of introducing professional diplomas and fellowship programs and shorter training for medical doctors and for other health professions. Moving from specialties to subspecialties is another direction, is stipulated also by the needs of healthcare in Sudan. As you know, healthcare is evolving everywhere. Technology is prevailing, and expectations of population are increasing. So we are creating now more of subspecialty programs, and I will be also touching on this. Moving from ad hoc to systematic residency management, and this is to ensure quality of training, and also moving from summative to formative assessment, also striving for quality. And this is all supposed to culminate into ensuring fit for purpose, fit to practice graduates for the country and beyond. Some of the quick outcomes of our reform movement, we endorsed a policy on training centers, whereby we started to decentralize training, and we established 5 training centers in Sudan. One of those centers is outside Khartoum, which is in Madani, and involving 4 states, the Jazeera, Blue Nile, White Nile, and Sennar State. And we have other 4 centers geographically located in Khartoum, but involving a number of hospitals from other states. So we have now created tracts for residents. For example, in one tract, we have the main hospital, Khartoum Teaching Hospital, with other hospitals in Khartoum and with hospitals in Niyala, in Al-Fashir, and in some other states. So also, we are more and more involving the ministries of health, coming together now with the Sudan Medical Specialization Board in terms of linking training and service together. We also started our movement to reform the specialty councils. We have, as I told, 33 specialty councils now under the board. We scaled up their meetings and performance, and we are introducing a number of subspecialty programs and new tracks, as I explained. For example, there are now subspecialties within medicine, within surgery, that are being created in the Sudan Medical Specialization Board. Most importantly, we recently added new specialty councils, notably the Council for Nurses Specialties and that for laboratory sciences, and we are introducing other health professions gradually. Also, we established an educational development center within the Sudan Medical Specialization Board to serve updating the curricula and developing the staff and supporting the specialty councils in different areas. We implemented a management reform in the board. We created a new organizational structure, and we attracted some qualified technical staff also to work in the Sudan Medical Specialization Board, and this will have an important bearing for this project. Also, we renovated the infrastructure in the board, and we introduced a huge ICT infrastructure, and we are now renovating the website of the Sudan Medical Specialization Board and introducing software programs to manage our system for registration and for deployment of resident doctors. Also, we instituted an important international collaboration program. We have a current program with the Republic of Ireland, whereby our residents will be spending 1 year in the Republic of Ireland for training and for service delivery. And a similar program with Saudi Arabia has already been instituted. We are now having some of our registrars spending some of their times in the Kingdom of Saudi Arabia in a collaborative program. And also, we instituted what we can call a South-to-South cooperation. We are now supporting the Republic of South Sudan, Somalia, Tanzania, and some other few countries in terms of training medical specialties for those countries. In addition, the Sudan Medical Specialization Board currently hosts over 200 medical doctors enrolling for a specialty from some Arab countries, including Syria, Iraq, Libya, and some other countries. And as you know, the situation in those countries, necessitates that Sudan also to play its duty in supporting training in those countries. Despite the progress we had in the board, still we are challenged by institutional capacity. And this becomes important in Sudan, in any organization, when you look at the migration landscape, where you start to build capacity and then you lose a number of your people due to out-migration. We have, challenges relating to training sites and mainly hospitals in terms of the equipment and the necessary arrangements to fit with the training needs. We have our major challenge with trainers, and that's why we are proposing this Diaspora engagement program. Despite the good number of trainers in the board, we are feeling that there is gap in some important areas that would need the effort from the Sudanese diaspora. Funding, of course, is a long-standing challenge, although we are improving a lot on this front. Now, the Sudan Medical Specialization Board gained financial autonomy, and it was recently enabled to use its resources, which helped us to improve a lot. Migration of health workers is an overarching challenge in the country, of course. When we come to the general landscape, Sudan, as we all know, is classified as a source country in terms of migration. There are established immigration of health professionals, and we have roughly over half of our medical doctors practicing abroad in this country, in the Republic of Ireland, in the Gulf, in particular Saudi Arabia, and in some other countries. And there are a lot of implications for this. Diaspora engagement, as you may all know, has been tried in a number of countries and is being advocated by a number of organizations. And for the Sudanese medical diaspora, we think it is rich in expertise, vivid and highly willing to contribute to in-country programs, and this has always been evidenced. There is outstanding record of contribution from the Sudanese diaspora. And the good thing that they are organized in active groups, associations, and networks, and I think you are aware of some of these networks. There are a number of initiatives, including collaboration with the Sudan Medical Specialization Board. So the diaspora, the Sudanese diaspora is always contributing, but in our opinion, this is not institutionalized and not systematic. So our aim is to really institutionalize diaspora contribution to gain the most out of it. In a previous study, the challenges for diaspora contribution were said to revolve mainly around robust planning, effective communication, and coordination from the side of country entities. And we are basing our program on this analysis, and we know that there is no comprehensive framework, and there are a lot to be dreamed for in terms of logistical arrangements to enable diaspora to contribute effectively. That's why we introduce this program aiming to utilize the full potential of the Sudanese diaspora to help us improve the coverage and quality of postgraduate medical education in the country. This is our proposed model. We are proposing a comprehensive model for diaspora engagement, not just only in one area, including three main dimensions: supporting specialty training, and this is clear for everybody because people from this country, for example, who are specialized in, say, pediatrics, could, provide the support to the pediatric council within the Sudan Medical Specialization Board, and this has been an area of known contribution for diaspora. But we are also proposing another two areas, which have been less common. One of them is supporting cross-cutting training. In the board, we are now having a number of programs on cross-cutting training aiming at, promoting generic skills like research skills, like writing skills, professionalism, ethics, a number of cross-cutting trainings that is running now in the board. We think that diaspora could have an expertise in this area. Also, we are proposing another dimension, which is supporting institutional capacity of the board. And in this area, we are inviting medics and non-medics, even people who have expertise in strategic planning, in business models, in organizational structure, in ICT, are also welcome to contribute within this program. So there are a number of, I'm aware that my time finishes, but I will just take one more minute to finish. Supporting specialty training programs, there could be a number of activities, as you see. In the cross-cutting training, there are also a number of issues. And in institutional capacity, as I mentioned, also there are a number of dimensions for contribution. This is the salient features of our diaspora engagement model. You have the abstract in front of you. Okay, so you have, thank you for giving some few minutes. In terms of implementation of the diaspora engagement model, This has always been the major challenge for contribution of Sudanese diaspora. As I said, as individuals in diaspora, we are contributing to our country in terms of paying visits and then, for example, delivering lectures and doing some aspects of healthcare, etc. But the challenge is to institutionalize this contribution. So in the Sudan Medical Specialization Board, we created a program management unit supported by suitable expertise and technical staff. And in the past, we have been listening to complaints of diaspora members complaining about even not finding somebody to respond to their emails and to communications. And this is true in the context of Sudan. When you look at the, now we are aware of this and we established our unit. There is a dynamic staff in this unit, and unfortunately one of them was supposed to attend this meeting, and due to visa she could not come. Therefore, we can assure you that now you will find, care in handling the communication and these issues. And this has been a very important aspect. We are creating currently a web-based application or platform to really enable diaspora members to enter their data, personal data, their CVs, their expertise, their areas of expertise, and we are aiming to create an electronic database which is going to be dynamic in terms of the diaspora expertise, so that to enable us to tap the right expertise from diaspora for our different areas of work. We are approaching this program in an action research approach. And we prepared a team in the Sudan Medical Specialization Board. We wrote a proposal, and some of our staff will be watching this program as it is implemented in a spirit of an action research, whereby we can generate data and produce information about the course of this program. And that would certainly help in terms of monitoring and evaluation, and then applying corrective measures to develop further the program in the future. So the steps for us started with identification of needs, gaps in the training in Sudan, and that has already been done. Definition of the model of engagement, the model has been presented to you now. And then determining diaspora potential. We are at this stage. So our invitation is clear to you and then to the wider diaspora group in this country and worldwide to check with our website in the Sudan Medical Specialization Board to register their expertise and in order to enable us to involve them in the program. Then monitoring and evaluation, of course. This is the implementation cycle. As for the implications, value and impact, of course, for the Sudan Medical Specialization Board and Sudan in general, contributions, the involvement of diaspora is going to contribute to the coverage and quality of specialty training programs, and hence to the coverage and quality of healthcare in the country. And this is very important aspect for us. Knowledge and technology transfer, this is a very valuable dimension. Technical support and useful links, this already has been practiced in a number of cases. Capacity strengthening within the Sudan Medical Specialization Board and beyond, because if one of you comes there and get involved, for example, in a teacher development program in the Sudan Medical Specialization Board, it means you are contributing to other agencies such as universities, because our trainers are university staff working in different universities. Then improvement of healthcare and health indicators. This is the ultimate goal behind this contribution. To diaspora members, I think our program will provide a unique platform for you to contribute to your own people and community. And I think this is an inner feeling in anyone who is residing or working outside Sudan. Any one of us is trying to find a way to contribute back to his country. Professional benefits also should be accrued from this program, and sustained interaction with colleagues inside Sudan and institutions in the country. Thank you very much.